60 million Americans have what's called pre-diabetes. That means the patients have higher than normal glucose levels and other signs that put them at risk for developing diabetes. Until now, there's been no solid advice for how to treat them. But as Tracy Potts tells us, there's now a game plan.
In testing blood sugar levels, there's a 25 to 60 point gap, depending on the test, between normal and what's clearly diabetic. That gap is what doctors call pre-diabetes.
Somebody with pre-diabetes usually has absolutely no symptoms, and they may not even know they're at risk.
People with elevated glucose face a higher risk of heart disease, sometimes just as much as those with diabetes. They also risk blindness, kidney failure, amputation, and death.
If you don't do anything, there's going to be a huge price to pay, and it's completely in your hands.
We cannot afford to allow this to happen.
The American College of Endocrinology brought together experts to study prediabetes. Here's what they suggest. Doctors should consider drugs to lower glucose, cholesterol, and blood pressure. Aspirin is recommended, but mostly focus on lifestyle changes. Lose weight, just 5 or 10% lowers your risk. Stick to a low-fat, low-salt diet and get 30 to 60 minutes of exercise 5 days a week.
When you don't hurt, when you're not suffering, when it's early, that's the time that you can hit a home run.
Doctors don't know how many pre-diabetic patients will actually develop diabetes, but they do know small changes can make a big difference. Tracy Potts, NBC News, Washington.
Treating pre-diabetic patients, though, is tough because there are no FDA-approved medications, so many insurance companies will not cover the treatment. Well, now to our